Hello everyone, I'm Dr. Key. Welcome back to my channel. Today, I want to connect some dots because many Sjogren's patients tell me the same things. I'm dry everywhere, my neck is so tight, I get migraines so often, my anxiety is bad, I always have gut issues, my legs swell, and I cannot take a full breath. What if these are not separate problems but part of one big pattern? Also, one important fact. You may have heard from your doctor that Sjogren syndrome patient has elevated risk for lymphoma, lymphatic system cancer. When immune cells are overly excited, it can raise the lymphoma risk. But is there anything that we can do to heal from Sjogren's and reduce the risk of lymphoma? My goal today is to go deeper into Sjogren's. My goal is to empower you with practical knowledge, the big picture behind it so you can create your health. And before you go deeper, I want to share a key philosophy. Everyone is unique and every person's life circumstances are different. There's no one magic pill that fits everybody. So today, I'm going to explain the big picture of Sjogren's, autoimmune disease in general, contributing factors, and what can be done in holistic standpoint. What I ask for you is be open-minded about healing today. I don't think pills can fix everything. Do you? So this video is for education purpose only and is not medical advice. Watching this does not establish a doctor-patient relationship. Please talk to your healthcare provider before making any changes to your treatment plan, okay? So let's start. Some patients are pretty concerned about genetic component. When their mom, dad, or siblings had autoimmune disease, they come see me worried about what will happen to them. Like we discussed in the last video, genetics is not everything. For example, in identical twins, even if one twin has autoimmune disease like lupus, the chance of the other twin having lupus is less than 30%. Less than 30%, okay? So yes, genes matter, but it does not solely determine the outcome. Diet, your body alignment, sleep, and stress also matter a lot in autoimmune disease, including Sjogren's. In my last video, we talked about what Sjogren's is, how dryness is treated in conventional Western medicine. Our focus at the time was the gland itself. Today, we're going to flip the picture. Today, we're going to talk about everything that support the gland function. We're going to talk about the key players around the gland that fuels inflammation in the gland. Perhaps some of the underlying causes, root causes that triggers the diseases in holistic viewpoint. Is there anything beyond just using medications? I think there is. Interested? Let me start with an analogy. Imagine you run a bakery in a small town, okay? To make great bread, what do you need? You need a daily supply of ingredient, flour, milk, strawberries, water. What else do you need? You need electricity for the ovens. You need the correct work environment, such as right temperature in the kitchen. And you need garbage disposal system. You will need well-maintained road and power lines in your town for all of this to happen. And also, the flour factory and power plant should be working correctly to send you the power, yeah? So same thing for our glands. They need constant blood and nutrition supply via blood. They need nerve signal from the brain. They need a sewage system. All our organs, glands, blood vessels, nerves, lymphatic system is wrapped in this connective tissue called fascia. Consider fascia as a city infrastructure that contains all the roads, water supply, power lines, okay? And the gland doesn't work well if the road is blocked. Let's say if someone is so tight around her neck from all the stress, the fascia is so tight, pressing on the gland, blood vessels, nerves, lymphatics, it's like cutting off ingredient supply, electricity, garbage disposal to your bakery. Can that bakery make quality bread? Not really. The fascia in your nervous system hold a key to your health. Again, the fascia and your nervous system hold a key to your health. The sad thing about modern Western medicine is that you can sometimes subspecialize too much, focusing on smaller and smaller details, especially medication and labs, and often forget about the big picture. We forget about the roads, infrastructure containing the supply chain, the power lines, garbage disposal. Your fascia is the road system in your body. It contains all of these functions in your body, all right? So Sjogren's doesn't define the entirety of one person's health. A Sjogren's patient can also have neck pain, migraines, sleep issues, menopause, just like everybody else. Every organ system talks to every other system. They are all connected and interdependent of one another through your nervous system, hormonal system, and fascia. We can't isolate one symptom and assume fixing that one thing would fix the entire system. Because if we don't address the underlying cause and fix just one piece, eventually something else may break. Symptoms, your clinical symptom can be like our body's alarm system letting us know, hey, there's something going on. Can you look into it? Even if we turn off the alarm, that one symptom, without addressing the underlying cause, we didn't fix anything. And when we try to treat the symptoms like dryness, neck pain, migraines, anxiety, insomnia, menopause separately with 6 different medications from 5 different doctors, like your PCP, psychiatrist, neurologist, sleep doctor, and rheumatologist, we may not be touching the fundamental pattern underneath. What is the root cause here? That's what we're going to talk about today. The big picture, the foundation. Stress, nervous system, fascia, breathing, and lymphatics. And if you're new here, I'm Dr. Key, triple board certified in internal medicine, rheumatology, and integrative medicine. I'm also trained in osteopathic medicine, traditional Chinese medicine, yoga, and meditation. I overcame chronic pain that haunted me for 15 years with holistic approach. My friends call me modality collector. I understand that everybody's journey is unique and special. My goal is to help you find what can be most beneficial at your specific stage of life and healing, okay? Let me tell you what I see in my clinic, not only in Sjogren's, but across autoimmune diseases and chronic pain clients, all right? A common pattern, high baseline tension, high baseline stress, like body is always on. And then tight neck and shoulders, especially the trapezius muscle, the tension feeds into migraine, sleep issues, can't find comfortable position for sleep, and mind keep running at night. Daily fatigue, anxiety, shallow breathing, chest wall tightness, chest palpitation, seeing cardiology for patch evaluation, gut issues, bloating, constipation, IBS type symptoms, and for many people, fluid retention, leg swelling, puffy face, although their mouth and eyes are so dry. Whether you consciously notice or not, all of these symptoms are directly or indirectly related to an imbalance between your sympathetic nervous system and parasympathetic nervous system. Your exhale pedal is always on, basically. People say, I cannot find the off switch. Today, I want to talk about how to return your shocked nervous system back to balance. We will talk about how to let go of these body tension and how to normalize your lymphatic system. All of these are essential to heal from Sjogren's, okay? So let's start with stress. Your body has an ancient survival program, fight or flight, the sympathetic nervous system. When it turns on, your body prioritizes survival. Blood flow shift toward fighting muscles like your shoulders and legs so you can run away or fight from the perceived threat. Breathing becomes faster. Pupils dilate to let more light in. Digestion slow down. Salivary gland, tear gland dry up. We are focused solely on short-term survival to run away from that threat. We don't need digestion or gland function for immediate survival, so we turn them off. And over time, your stress hormone cortisol rises, inflammatory hormones also goes up too. The immune system becomes dysregulated. Inflammation happens and people get stuck there in their pattern. Here's a key problem. Our 2 million-year-old brain has an outdated program. The rate of evolution has not caught up with the speed of development of our civilization. Our brain cannot distinguish between a real physical threat and a chronic social or emotional threat. T-Rex chasing you versus sitting next to a mean boss for 8 hours, although the mean boss wouldn't physically kill you. True life-threatening emergency versus fear coming from approaching deadlines or money problem. They push the same button. Fear emotion from all of these trigger the same sympathetic nervous system. This fight or flight is originally designed to run away from short-term stress. But if stress persists for months or years, the body can stay in a low-grade survival mode. Our system gets out of balance. on this go, go, go mode, people are depleting energy because we are burning more in stress, yeah? We don't have any energy left for repair or healing at the end of the day. This results in chronic inflammation, disease, and accelerated aging. This matters especially for women. Did you know around 90% of autoimmune disease patients overall are women? There are many reasons, immune biology, hormonal influences, but practically in clinical setting, in my clinical setting, I also see more chronic stress load, more internalized stress in the body in women. So when emotional stress meets poor diet, poor body alignment, lack of sleep, the system can be more vulnerable to inflammation. Does it make sense? And add hormones from menstrual cycle or menopause to that. In menopause, hormonal shift can amplify insomnia, emotional stress, pain sensitivity, fluid retention, vaginal dryness, and the nervous system goes haywire, amplifying the issue. It can be so confusing and also overwhelming for women. So yes, this topic matters a lot. Now let's talk about mechanics because stress shows up in the body. We also say the body keeps the score. Have you heard of that expression? When people tell me my shoulder feels tight, it's rarely just the shoulder muscle by itself. A lot of time it's the whole connective tissue web, the fascia, getting stuck in a restricted pattern. Fascia is the connective tissue web that envelop all of your muscles and organs. It gives you the framework in which your muscle tissues, bones, organs glide against each other freely. Also, as we talked about earlier, fascia isn't just packing material, it's a living network where your nerves, blood vessels, and lymphatic pathway travel. When there's restriction in the fascia, that becomes an issue. We call that somatic dysfunction in osteopathic medicine. The body is moving less freely and one area start compensating for another. So when fascia gets tight, it can affect circulation, nerves, and lymphatic flow, and that can amplify that heavy, tense feeling many Sjogren's patients recognize in their neck and back. In traditional Chinese medicine, TCM, we say disease occurs when emotional and spiritual trauma gets stuck on the body. If I may explain that in more Western terminology, with life challenges, the sympathetic nervous system gets turned on and your body often enters a guarding pattern. When the emotional trauma is not processed or cleared adequately from our system, sometimes body holds on to that guarding response in the fascia and cannot let go. Neck tightens, upper chest tightens because they are connected, shoulders lift, jaw clenches, TMJ, and breathing changes, shallow, fast, upper chest breathing, less belly expansion, ribs get stuck in the wrong position, our spine gets stuck in misaligned position, further impairing the function of our autonomic nervous system. Our structure and our function are very closely linked. Some people feel I can't breathe comfortably or it feels like something heavy is sitting on my chest. In conventional medicine, if the heart workup is normal with normal lab and EKG, this can be labeled as anxiety and you may be sent home. But oftentimes, what I see is that there's a real physical pattern, tight ribs, tight accessory breathing muscles on your neck, and restrictive diaphragm. And there is a little bit more to it. It's not just our stress response. A lifestyle component also plays a key role. With our modern habits of sitting for long periods, we develop like poor neck alignment, rounded shoulder, tight psoas muscle in your hip, and poor back alignment, yeah? It's not just the fight or flight stress response, but now the stress response plus structural misalignment due to lifestyle together cause dysfunction and disease. When structural alignment is off, it will negatively impact the function. Does it make sense? You with me? It may be beneficial to watch this video a couple of times because I'm putting what I learned in medical school and many other holistic teachings in one short video, okay? Let's talk about diaphragm now. It's one of the biggest muscles in our body and it has a huge role in our health. We don't really talk about it very much. The diaphragm is your main breathing muscle. The moment that you're born to the moment that you die, this muscle doesn't stop working. Have you seen a baby breathe, deep breathe with their belly? Their brain hasn't developed the stress response yet, so babies know how to breathe properly. In adults with stress, we tend to go into shallow, rapid breathing, and our breathing mechanism gets altered. Surrounding accessory breathing muscles on your neck and between ribs will try to compensate and help out the diaphragm. Eventually, they will burn out too and remain shortened, contributing to the tension. Breathing becomes uncomfortable. That's a vicious cycle, and it has important downstream effect. Did you know diaphragm serves a vital function in your immune system? It does it via its relationship with lymphatic system. Here's where we connect to lymphatics. The lymphatic system is often called the body's drainage system, like a sewage network. Let me break it down the big picture. Your heart pushes oxygen-rich, fresh blood to your tissues, for example, your salivary gland. That oxygen-rich blood gets delivered to the gland. It unloads into the tissue for use, for metabolism. Some of the fluid gets picked up by the venous system and goes back into the heart. And the remaining fluid is picked up by the lymphatic system. So the lymphatic system helps clear excess fluid, metabolic waste, and inflammatory byproduct in that tissue. And lymphatics are also key component for your immune system. Lymph is a highway for immune cells and immune signaling, okay? But unlike the bloodstream, the lymphatic system does not have a central pump like the heart. So what moves lymph fluid? Two major things. Number one, muscle contraction and joint movement, like walking or movement. And number two, chest cavity pressure changes from breathing, diaphragm movement. So when we take a deep breath like a baby, the diaphragm descends and creates suction in that chest cavity. That suction pulls air into the lung. And that same suction is also a major mover of lymph fluid. So if your breathing is shallow, the diaphragm is restricted, lymph flow can become less efficient. So now picture a bottleneck. Your lymphatic fluid from the head, arms, and legs ultimately drain toward the area near the collarbone called a thoracic inlet. So once it can be emptied, the lymphatics gets emptied here. It will go back to venous system to be removed by our kidney, for example. This region is a naturally very tight space. A lot of important structures pass through it. If the neck muscle and fascia are chronically tight here, that area can get even more compressed. So imagine this combination: shallow breathing, ribs stuck in a stretched position, restricted diaphragm, the breathing muscle, tight neck and chest fascia, and not enough daily movement. That can create a traffic jam, restricted drainage. So they got a dump here, but it's backing up. It's like trash hasn't been picked up and it piles up across your driveway and to your house. As you can imagine, this can make your immune system quite upset and angry, contributing to inflammation. Wouldn't you be angry if your house is filled with trash? Same thing for the immune system. It can get overloaded. I'm not saying lymph stagnation alone causes lymphoma. Lymphoma risk in Sjogren is complex with more than just one factor, including genetics, right? What I'm saying is this: what if we can reduce emotional stress load, support the nervous system so it can go back to balance from shock, support better breathing mechanics, support movement of flow, and then that can improve whole system, including lymphatic system, to build foundational health. Perhaps there is nothing wrong with the gland itself. If the surrounding fascia has so much tightness and the blood supply, nerve signal, and waste removal are compromised due to all the tension, gland cannot work well. If metabolic waste and toxins can be cleared very well from your gland, your immune cell will go in there to clean. Overactive and irritated immune system can cause damage in there. That's the definition of autoimmune disease. All right, so what do we do with all of this? Let me show you how I generally treat Sjogren's patient, okay? Again, each doctor can have very different style. This is the big framework for integrative approach that I use. So there are three pillars of health: physical alignment, nutritional alignment, and emotional alignment. You need all three. So let's say I'm treating this imaginary client. Let's call her Sarah. Sarah is in her 50s. She has Sjogren syndrome and hypothyroidism, Hashimoto's. She has two kids, and there are stressors in life. She's a working mother, and she's also going through menopausal symptoms right now, and she feels dry everywhere. She feels tight on her neck and back. She gets migraines often. She has sleep issues. She suffers from chronic anxiety. Work has been stressful. She wants to be the best mom she can be, but there has been some challenges and work has been overwhelming. So what should we do? Step one, physical alignment. For the treatment portion, the first thing that I usually do with my client is I teach them a sub-occipital release technique. It looks like massage. This is an osteopathic manipulative technique, a hands-on technique. You might be wondering, why are we talking about massage technique for Sjogren's? There's a reason, because people have really hard time relaxing their nervous system. And this works well for many of my clients, so it's easy to do and it's free. Basically, we place our fingers underneath the occipital, the bony portion behind the neck, and cradle their head in my hand, creating a healthy C curve. So I'm holding their head and cradling it, and then pulling a little bit so that they are laying down, facing up, and I'm stretching their head, creating this space. So what we are doing is we open up that area where the vagus nerve, the relaxation nerve, it comes up here. So vagus nerve comes out from your neck and goes to the rest of the body. The goal here is that she can learn how to turn off her go, go, go mode. That's first. I usually have clients come in as a couple or with somebody if possible, so I can teach the spouse or partner. Then they can do it at home, especially at night before bedtime, so that they can get some relaxation and rest at night. If you have DOs in your area that offers osteopathic manipulative technique, you can also learn from them. Or there are very knowledgeable physical therapists and massage therapists out there. They are another option you can learn this technique from. And then I teach them some breathing techniques, but we're not gonna cover that in this video. Next is acupuncture. I refer my clients to acupuncture quite a bit. So why does acupuncture work? Like we said in Chinese medicine, emotional and spiritual trauma that gets stuck in the body can cause blockage, and blockage causes disease because it blocks the normal flow of energy, right? In Western terminology, if emotional trauma is not processed and released properly after the trauma, it creates guarding pattern in the fascia, causing the tightness. And the tightness presses on blood vessels, nerves, lymphatic channel that runs within the fascia. Do you remember that? Do you remember the bakery analogy? We are losing supply of ingredient, power, and waste management system due to hurricane in town, for example, stress. What acupuncture do is that they place needle into the tight fascia. That's the destination. Needling alone can be enough. Sometimes there are several things we can do from there. For example, we can hook the needle up into a machine, run electricity in healing frequencies into the tissue, letting the tissue relax, muscle and the fascia to relax. One of the rationale is to send electrons to blocked regions, inflamed regions, so that we can cool down free radical damage in this inflammatory process. Also, using moxibustion. Moxibustion is heated herb stick. We put the moxibustion stick near the needle. The tip is still in the fascia, right? And we can deliver the gentle heat into the fascia. With the heat, it can loosen tightened restricted fascia. Acupuncture benefiting autoimmune disease is not a new concept. Most of research studies are done on rheumatoid arthritis, RA, because RA is the most common autoimmune rheumatic disease. For RA, acupuncture is now part of integrative treatment guideline published by the American College of Rheumatology. So it's in the guideline. So I send my client to acupuncture quite a bit. If clients are really tired and overwhelmed, I usually start with acupuncture or massage consult for the passive side of healing. You just need to lay there and receive treatment, right? One important thing you need to know is you need to find someone you can trust and feel safe. If you feel uncomfortable in their bed, still remain in tension, acupuncture doesn't really work. So you may need to try a couple of different providers to find somebody that is compatible with you and you feel comfortable with. Another modality that I would routinely use is physical therapy. The main focus is to fix that neck alignment to open up the neck area for proper breathing and lymphatic drainage. When neck is aligned properly, tension improves. Most of the time, it's not just neck pain. People have back pain too, often a lot of back pain. Once they are done with PT for neck and learn the neck alignment exercise, it's best to learn core alignment exercise for back to create daily full body routine. So addressing neck and back alignment together is a key. People build up their mobility, flexibility, and balance using this approach, and then the final destination is to find either yoga, tai chi, or Pilates, whichever is more suitable for the client. For my client younger than 50s or 60s, I generally recommend them to go into yoga. And for clients over 70 or people with some mobility issues, I tend to put them into Tai Chi class. These mind-body exercise over time improve their alignment by engaging the fascia throughout the whole body. It's like doing the tire alignment for your car. Consistency is the key. Rome wasn't built in a day. Whether you stick with PT exercise or yoga or Tai Chi, if you do it for just 12 sessions and stop, it won't create the desired result. Healing has more to do with pattern creation, habit creation. So we gotta notice habits or patterns that create diseases and we need to stop them. And we need to install a new healthy pattern and continue it. And that's the key. It's all about pattern recognition and pattern creation. Another thing, now I want to say one nuanced thing here. There's no direct data on use of sauna specifically for Sjogren that I'm aware of. We do have data that sauna use can improve inflammatory markers like CRP in some settings. And sauna has been associated with health benefits such as lower death rates from cardiovascular disease and stroke, right? So now you might be thinking, wait, sauna, I'm already dry. Here's how I want you to consider it. For many people, Sjogren's is not just a dryness problem. It can also be a fluid distribution problem. So as we talked about, if fascia is tight, it can compress the supply chain, the blood flow, lymph flow, nerve signal, and the gland may not function very well. And heat can increase elasticity or stretchiness of collagen tissue in fascia. So for some people, gentle heat exposure using sauna can be helpful in loosening up the tight fascia. But be smart. If heat makes your symptom worse or you're getting dizzy or your eyes or mouth flared badly, don't force it. Talk to your clinician, drink enough water, listen to your body, right? The next section is nutritional balance. For nutrition in autoimmune diseases, we often talk about the anti-inflammatory diet. So an anti-inflammatory diet is essentially plant-rich diet. For my clients, I recommend 70% of their plates to be filled with vegetable because pigmentation within veggie have this thing called a phytochemical, and these are good chemicals. They're known to cool down inflammation. Also, we want to avoid ultra-processed food like spam, and we also know people who consume refined sugar like soda tend to do worse with autoimmune rheumatic diseases. So it's important to check the food labels. Even for orange juice, bottled orange juice, the label may say 19 grams of added sugar per serving. You don't want that all the time. My rule of thumb is do the right thing 80% of the time and it will carry you to the right direction. If you go on a date and want an ice cream for dessert, go for it, enjoy it, but don't eat the sugar stuff every day, right? In that way, you will make your soul happy and also your body happy. So removing refined sugar is important for reducing inflammation for most people. Healthy fats, especially from fatty fish like salmon, mackerel, and sardine, are known to be anti-inflammatory. And extra virgin olive oil can be helpful too for proper immune function. For hydration, usually I talk about around 60 to 80 ounces of water per day for most people. Now that depends on the ability, your body's ability to handle fluid. If you have issues with leg swelling, you've got to adjust and you do need to talk to your doctor about what's appropriate for you. We also talked about celery juice in my last video. And one more point about hydration. This matters not just for your energy and circulation, but for fascia too. It needs to be well hydrated to stay loose and function smoothly. When you're dehydrated, your body can feel tight and more restricted. Body needs clean water throughout the day, not the venti-sized coffee or soda to function properly, okay? Now let's talk about emotional balance. For Sjogren syndrome, if we ignore your stress response and nervous system, we're missing a huge piece of the puzzle. So first, I want to explain something called HRV, which stands for heart rate variability. HRV is basically one of the best modern markers we have for now to show how stuck your nervous system is in stress mode. This is what your Apple Watch or Oura Ring measures to estimate how stressed you are. In general, higher HRV tend to mean your body can shift into relaxation more easily, so that's good. Lower HRV often correlate with more chronically stressed state. So here's a simple physiology. When you breathe, you create a pressure change in your chest. When a baby is relaxed, not crying, right? Or when a very relaxed adult breathe like a baby, it's like belly breathing. Belly breathing, inhale and exhale. The diaphragm moves down and then lung expands fully, and that creates big suction effect in the chest. That suction helps blood return back to the heart, and depending on inhale, exhale, the amount of blood returning changes a bit, and heart adjusts its rate in response. We talked about healthy breathing pattern also help with lymphatic drainage, right? Just like that, if you have relaxed breathing, it also helps blood come back to the heart better too. That natural rhythm, speeding up a little, slowing down a little, it's called a heart rate variability. Now compare that to a stressed breathing pattern, shallow, rapid, upper chest breathing. That kind of breathing cannot fully expand the diaphragm. It can't create the full suction effect, and over time, HRV tend to drop. And here's where it connects back to Sjogren's and the whole body stuck feeling. Your lymphatic system is heavily influenced by diaphragm movement. So if the diaphragm is tight and your breathing is shallow, you're not just stressed, you're literally reducing one of the major pumping mechanisms that support circulation and lymph flow, your immune system. So yes, breathing is linked to your emotion, but it's also mechanical. It's plumbing its flow. So we discussed that our brain runs some very outdated programs, and our nervous system can't always tell the difference between a tiger chasing you and working in a emotionally toxic environment like sitting next to a mean colleague, right? They push the same button, sympathetic nervous system. So now the threat isn't a tiger, it's your thoughts. But the thing is that mean colleague sits next to you for 8 hours a day. He or she doesn't go away, right? If you have an unpleasant interaction with that person, even after you come home, you think about that event, go to the bed thinking about it, and the stress response stays on all day and night, that can't be good for your health. With the tiger, the stress response is an event. With the colleague, the stress response becomes lifestyle, long pattern, habit. Your body stays in guarding mode even when you're home on your couch. There's nothing wrong with emotions like anger, sadness, fear. Those are human. The goal is not to feel nothing. The goal is how can we come back to baseline, peace sooner? Can you return to your homeostasis balance? That's the key. Meditation trains the skill of coming back. This is where meditation becomes so powerful. Among many benefits of meditation, studies show that it also improves HRV. Meditation helps you step back and objectively observe your thoughts and emotions. When you are so stressed, we get tunnel visioned. Meditation, it trains your brain to create space between the trigger and your reaction. It trains control over your thoughts, your actions, and your emotions by becoming aware of them. And that's how you create health and healing. You stop letting the nervous system run your life on autopilot in fear. My teacher, Dr. Joe Dispenza, teaches that the key is to have a different thought in the exact same situation. For example, tomorrow at work, how are you going to think differently, feel differently, act differently? That's the key. Meditation can help your brain rehearse who you want to be and who you no longer want to be. Whenever you step into the fear response, when you're aware of the vision, your desired vision, you can consciously intervene. Hey, this is not the way I want to think and feel, and halt negative thoughts and emotions rather than staying there for hours and days. It is a trainable skill, okay? There are different versions of meditations out there, and it doesn't have to be just sitting meditation. Yoga and Tai Chi, consider them as moving meditation as well. They have also been shown to improve HRV in some studies. Traditional Chinese medicine has some simple idea that I love because it's so true. It says, where there is flow, there is health. Where there's blockage, there's disease. And a lot of times they also say, where there's blockage, there's pain. So when you think about Sjogren's, yes, we're talking about immune dysregulation, inflammation, and dryness. But on a deeper level, I want to ask you, where is the flow not flowing anymore? Because when your nervous system is stuck in fight or flight, your body tightens, you guard, you brace, and over time, that guarding becomes your default. And then blood flow changes, nerve signaling changes, lymph flow gets blocked, and you start to feel it everywhere. Now, this is where yoga and Tai Chi become more than stretching or exercise. To me, yoga and Tai Chi are moving meditations. I have done yoga more than 750 hours so far. It healed my body with meditation. Using movement of body, you are learning how to move energy. And what they are really aiming to do is help you connect with something bigger than you, your higher self, the universe. Some people call it God. And when you get into that state, it's like you start downloading a higher frequency. Love, gratitude, peace, and you use that to flush out the stuck emotional trauma in your fascia. Let go. Again, many of us are carrying emotional and spiritual trauma, old fear patterns, old sadness, old anger, and the body stores it, the fascia stores it, the nervous system remembers it, the breath stores it. So as you move, as you breathe, as you soften, as you come back into the rhythm, you're not just working out, you're letting go of the guarding, you're flushing out stuck emotional energy, you're giving your body permission to feel safe again, okay? Your nervous system to feel safe again. And when the body and nervous system feel safe, that's when healing becomes possible. There's also emerging data looking at vagus nerve stimulation using implanted device and autoimmune disease, mainly on rheumatoid arthritis. A recent study showed that modulating the vagus nerve, the king of parasympathetic nervous system, the relaxation nervous system, positively influenced immune signaling and inflammation. Your nervous system does affect your immune function. So now I'm not saying you need to surgically implant a stimulator. That's not the point. The point is if vagus nerve stimulation, the relaxation nerve stimulation can shift your immune activity and calm down your overactive immune system, then chronic stress is not a side issue anymore. It's part of the core terrain. Those studies suggest that stress is the root cause of diseases. So emotional regulation isn't extra anymore. It is foundational in your healing. And in the end, like Albert Einstein said, E equals mc squared. We live in duality. In one dimension, we exist as tangible body, this body in this 3D world. On the other dimension, we exist as energy, frequency. Energy is the blueprint for your 3D world. Everything is energy essentially. And in order to heal, we want healthy blood flow, nerve signaling, lymph flow. Emotional and spiritual trauma is information, a form of frequency. Consider your fascia tuned into radio station of emotional trauma, and body tension is the result. When fascia is tight, it compresses on blood vessels, nerves, and lymphatic system, right? Compromising our gland function. So emotional and spiritual healing is a key component. That's the root cause, according to traditional Chinese medicine. We got to help train our nervous system using meditation, yoga, tai chi, acupuncture to tune into a different radio station that plays music of love, gratitude, harmony, and balance. I think your nervous system deserves that. There are many ways to clear stuck energy. We talked about meditation, yoga, tai chi, acupuncture, and we talked about body alignment exercise with PT and proper nutrition are also important in healthy function, right? So my invitation to you is simple. Pick one. Commit to one this week, perhaps. Take action. If you're wondering where to start, there are amazing teachers out there. For meditation, there are great teachers like Dr. Joe Dispenza or Transcendental Meditation. There are books out there, documentaries out there. Check them out. You could also consider looking out for some yoga or Tai Chi class in your town, or ask a friend for a great acupuncturist or massage therapist in town. Because the goal here is not just to treat symptoms, the goal is healing from emotional spiritual trauma, the root cause. We want to help your nervous system return to peace, and we want to live life with more heart-centered emotions like love. So in conclusion, bringing everything together, the goal is to address the root cause, emotional spiritual trauma, nervous system, breath, fascia, breathing, lymphatic system, so your system can come back into balance. And that's where healing starts. This is how I treat all chronic diseases, not just Sjogren's. There are more amazing healing modalities and details I couldn't include in this video. It will take a day. Comment below if you are interested in hearing more about holistic healing. Thank you.